September is Afib Awareness Month. I'm happy to team up with my friends over at Cardiovisual alongside the other awesome educators that you're seeing featured. Here, I'll be reviewing rapid identification of Afib on the ECG from a single lead basic rhythms and nursing perspective. Now, Afib is the most common arrhythmia in the adult population and accounts for over 30% of arrhythmia-related hospitalizations by some accounts. All of this is to say that we should expect to encounter it at some point and be well prepared to recognize the expected changes on the ECG. So, if we encounter a rhythm with no discrete P waves that's irregularly irregular, the chances are very high that it's atrial fibrillation. Irregularly irregular simply indicates that we have no way to make an educated guess or predict where the next R wave is going to land. Now, the baseline here may be coarse and erratic, or it can be extremely fine and near isoelectric. This is why I'm not a big fan of necessarily relying on fibrillation waves at baseline, although they may be present and more evident in some leads, like V1 for example if you're looking at a 12 lead. This irregular pattern that we're seeing is a result of the AV node being bombarded with somewhere between 300 and 600 atrial impulses each minute. Thankfully, we have the AV node to play a protective role as gatekeeper in these instances. Now, ECG appearances can vary greatly in Afib, from rate controlled to having a rapid ventricular response. The QRS may be narrow with typical supraventricular conduction, or it may be wide if an underlying conduction delay is present. But what we expect all of them to have in common is, say it with me, a rhythm that's irregularly irregular without any discrete P waves. Now, of course, it is possible to have atrial fibrillation with a complete heart block, or underlying atrial fibrillation with a ventricular paced rhythm, yes, but here we're sticking to the basics. Now, on screen are a few more potential appearances that atrial fibrillation may take. But as long as we remember what each of these have in common, then we're on track to set ourselves up for appropriate identification. The goal being so that we can report changes to the provider quickly and achieve the most appropriate treatment outcomes for our patients in the most timely manner possible. I hope you found this quick review equal parts entertaining and helpful. And I'll go ahead and turn it over to my friends here for more information.